I was injured about 5 years ago at school. I teach 8th grade, and we were having an evacuation, and there was ice, and I slipped on the ice. So I went through emergency, had to go through orthopedics, and was diagnosed at that time with sacroiliac and hip injury. And I went through all kinds of things with that for the last 5 years, and the bottom line is they misdiagnosed it.
In the year 2000 in March, I was injured on the job where I fell, and it was this somersault in the air, landed on my back, and progressively got worse, and it took 2 years for them to decide to do surgery. And after that, I went into surgery. They messed up and cut some things they shouldn't have, and started having seizures right away, right out of the operating room. And they had me on like 7 different types of pain medications. My legs were starting to get to the point where I couldn't walk anymore. I was in a wheelchair, pain constantly. Just really nightmarish type thing going on.
In March of this year, I had a car collision, and I had a severe neck injury, whiplash, and I called Dr. Kurtz, and he put me in a treatment. I could not even move my neck at all.
Well, the typical patient that comes into Columbia Basin Spinal Rehabilitation Institute is primarily someone who's tired of being in pain. Most of them have done the traditional medical approach. They've had medications, the recommendation for surgery, even physical therapy to a point. And so they're willing to try something else. And we try to utilize the latest non-invasive spinal care to help them get over their pain. We go through a thorough history with them to find out what they've been through, and then we offer a treatment plan.
My treatment goals are pretty simple. First of all, I want to decrease the pain. I'd like to increase the range of motion. That way the patient can be as pain-free as possible and live an active and healthy life like they were before they got in any accident or injury.
Well, non-surgical spinal decompression is an alternative to surgery. The goal is to get the disc or the joints between the discs to alleviate the pain. As gravity compresses our spines down, the disc herniation, if that's what the problem is, will ooze out and pinch or irritate the nerves. The goal of non-surgical decompression is to take that area and to open it up, and so that it takes the pressure and the irritation away from that. In surgery, they would cut open the area and cut out what's ever causing the problem, and possibly use metal rods or different types of bone implants to decompress that area. We try to do that using a more natural means, using specialized table and equipment. We treat specific cases such as disc herniation, disc bulge, disc degeneration, spinal stenosis if it's not too severe, and as well as chronic low back pain that hasn't responded to any other type of therapy. Spinal decompression therapy is a painless procedure. You have total control when you're on the table. We give you a control button that if you do notice any discomfort at any time, you can push it and it will automatically stop. The goal is not to induce more pain. The goal is to remove the pain. And so it's a very comfortable procedure. Most people even fall asleep while they're doing the procedure.
After the injury, they scheduled me actually to replace my hip, and fortunately that didn't go through since it was an incorrect thing. They gave me cortisone in my hip, they gave me cortisone in my side of my leg, they gave me cortisone in my back. I took water therapy, I took physical therapy. I asked Dr. Kurtz to look at my x-rays and tell me what he thought he could do. The only relief I really got was when I'd have my back aligned. And finally, Dr. Kurtz was able to tell me about the spinal aid. And with that, then I was able to actually get some healing.
After the surgery, they said you just have to live with it, can't do much for you, sorry, just try to deal with it. And it was something that I couldn't deal with. I said, no, I got to find something else. This program that they have here decompression. I started doing this and I started seeing results. You know, a couple weeks later, I started noticing that I wasn't in pain as much. I could walk without having to, use canes or sit down every 5 minutes because I wouldn't be able to stand, sit, or walk for more than 5-10 minutes at a time. The seizures started subsiding, and pretty soon, just progressively over time doing the treatment, I started being able to do better. I haven't been on a wheelchair since, so it's really been, to me, a godsend.
We offer several different types of services here at Kennewick Basin Spinal Rehabilitation Institute. Chiropractic care is the primary service that we offer. I graduated chiropractic college in 1990 from Life Chiropractic College West in California. Since then, I've realized that you need several different types of equipment to help the individual. Come from a long line of mechanics in my family, and my dad always told me that if you want to fix more things, you need more tools. So I learned early on that you need more equipment to help these people get better. So we utilize the latest in non-invasive therapies and techniques to help these people get over their pain. From manual adjusting techniques to the new instruments that are computerized, and they can help analyze the spine even at a greater level than a human can.